The Omicron variant is not only impacting emergency service staffing levels, it's impacting how people will be treated for COVID when they do call for help.
Cowan tells us more about those new changes as we look at the impact this surge in cases is having on emergency calls and first responders.
911 calls have increased during the pandemic, putting pressure on frontline workers. And when the system isn't used properly, it ties up emergency services.
And when you tie those up, you're taking where officers should be dispatched, such as emergency situations where somebody could be in danger or needs immediate police assistance.
Calls to 911 are answered by police dispatchers and then passed on to fire and ambulance as needed. Halton police say calls go up during lockdowns and whenever the province enters into a new stage.
I mean, some of the calls we're getting right now is on 911 or people who can't find booster shots. And so they'll call 911 and ask if we have information. I think people's frustration levels are going through the roof.
But please don't call 911 if you have a raccoon in your attic, or if you have a bat, or if you have a raccoon in your driveway. I know in Norfolk County, we still respond to people calling the police, thinking that we're animal control.
First responders are not only dealing with staffing shortages like most workplaces in Ontario, but also daily changes and directions from the government when it comes to COVID protocols.
It's definitely days where people are treading water because there's no manual for anyone. I find at times I send out an email to my team, and as soon as I send it out, I get a completely opposite direction from whether it's the province or public health. And so it's very fluid, and you have to, I think sometimes people are just tired.
It's something Hamilton paramedics are struggling with as well.
Well, they're challenged. There's no question in my mind they're challenged. Paramedics are not only part of the healthcare workforce, so we have the same challenges that they have in the hospitals, nurses and physicians. They're running from call to call to call to call. It's very busy in that process.
In order to keep up with the demand, the City of Hamilton has issued new direction on ways to respond.
Those with mild or stable COVID-19 symptoms, we can leave them in the comfort of their home rather than transporting them to the hospital. With the right type of education and what we're calling leave materials, so that we can leave materials and education with the patients on how to access other care if required. Obviously, if they need to be transported to hospital, they're going to be transported to hospital.
It's hoped that these new measures will free up paramedics to respond to life-threatening emergencies, and officials say they will be in place until they're no longer needed. Cowan, CHCH News.